Got any questions for me? JM is the key. This is John Mendoza, and welcome to my vlog. Splints are non-circumferential immobilizers that accommodate swelling and are used to prevent motion of injured body parts. Sugar Tong splint is a device applied to stabilize injuries of the wrist and forearm. This prevents motion such as rotation, supination, and pronation. Indications include distal ulnar fracture, are commonly known as your Cole's fracture, and your distal radial fracture. Prepare the following materials. Stockinette that is enough to cover the area from the MCP joints to the mid-humerus. Roll padding of 7.5 cm in width. Plaster or fiberglass splinting material that is long enough to cover from one aspect of MCP joints, then around the elbow, to the other aspect of the MCP joints. Elastic bandages, and lastly, measuring tape. First, introduce yourself to the patient, explain the procedure, and secure consent. Properly position the patient where there is appropriate access to the patient's affected extremity, and in this case, the patient's left forearm. Measure the splint needed using the non-affected arm. The length will be from the dorsal MCP joints, then around the elbow to the palmar crease. Next, apply the stockinette to the injured forearm, extending 2 inches beyond the splinting material to prevent skin irritation. Apply the splinting material, maintaining the elbow position at 90 degrees. Fold the excess stockinette over the edges of the splinting material. Next, apply the elastic bandages over the splinting material. Make sure that the fit is snug but not too tight. The forearm should be maintained at a neutral position with the thumbs up. MCP joints should be freely movable and the wrist is at 10 degrees of the palmar flexion. Check for neurovascular status such as capillary refill time and mobility of thumbs and fingers. Thank the patient and ask for any questions or clarifications. Follow me for more videos on JM is the key. Adios!